Thank you.
Okay, I think we're going to go ahead and get started. Thank you, everybody, for joining. My name is Barry Sarvet. I'm a child psychiatrist, and I'm the medical director for MCPAP. And we want to welcome you to our clinical conversations session today, which, as you know, takes place on the fourth Tuesday of every month. Today's topic that we have organized for you is on basically the issue of how to talk about our coronavirus crisis with children. And we've assembled a panel of 3 of our behavioral health clinicians who are part of our MCPAP teams to discuss this with you and to hear from you with questions as well. So we're excited about that, and thanks for joining us. Just a couple of housekeeping issues. The session is going to be recorded, as always, and is available on the MCPAP website at www.mcpap.org. There will be a copy of the slides that we have on the MCPAP website under the newsletters and webinars page under the About MCPAP menu. The presenters will take questions from the audience, and we also will try to have some time at the end. Actually, the whole thing is going to be question and answer, so it's not going to be at the end necessarily, but we really would like to have interaction with you. So if you have a question or comment, just type into the question box during the presentation, and we'll read your question, or you can say when you type it in that you'd like your line to be unmuted, and we'll do so, and we'll call on you and unmute your line to let you ask your question yourself. At the end, everyone's gonna receive a brief survey, really just a very quick and dirty survey just to ask for feedback to help us improve future presentations. So I do want to introduce our presenters on our panel. We have Danette Mucaria, who is a licensed independent clinical social worker, and she received her master's in social work from Smith. She's part of the West Central team and works at UMass in Worcester. She currently provides psychosocial and diagnostic assessments, phone triage, and resource and referral coordination. She has 20 years of experience as a clinical social worker providing services to kids and adults and families in a variety of settings, including inpatient, outpatient, schools, and community counseling centers. By the way, Danette is also bilingual, fluent in Spanish. Martine Vanpee is next. Martine is also a licensed independent clinical social worker who also got her master's in social work from Smith. She's part of the West Central team at Bay State, and she's worked in the field since 1983, has lots of experience in lots of different settings. She used to work at Harvard Vanguard Medical Associates and the Boston Institute for Psychotherapy and the Cambridge Somerville Early Intervention Programs. She has a special interest in parent-infant psychotherapy, developmental assessment, crisis intervention, DBT, and psychotherapy with all ages. She's also bilingual. In her case, she's fluent in French, and she's been with MCPAP since 2017. And lastly, but not least, we have Mark Tucker, who is the newest member of the MCPAP Boston South team at McLean. Mark is also a licensed independent clinical social worker and also has a great deal of experience working in a variety of settings, including hospital units, emergency departments, schools, cognitive rehab centers, and a variety of outpatient services, and DMH, DCF, and She's also worked in OCD residential program. And so, so we're going to proceed, and we're really excited to have our panel, and thank you again for participating. So I'm going to pitch questions to this distinguished group, and so we're basically gathering questions that we've received and that have occurred to us that we think are likely to come up for primary care providers. And I guess the first question, I think I'm going to field this one, and others can help me, but the question is, what has MCPAP been doing during this COVID-19 outbreak? And so I guess I'll just say briefly that the bottom line is that MCPAP is open for business. That by its nature, MCPAP is a remote clinical program. And so we're offering our services as usual. It's taken us a bit of time to get our systems, and we thank Beth and others for an enormous amount of work to kind of be able to maintain our service. So the phone lines are unchanged. We're continuing to do research and referral. It's more difficult nowadays to get appointments for people because of the impact of the crisis on outpatient services. And so, but we are still working with the providers in the community and keeping as up to date as we can as far as who's open and who's offering telehealth services for referrals. All of our face-to-face visits are moving to telehealth. And so a number of the teams are already up and running, kind of doing their face-to-face evaluations via telehealth and working with their local institutions to enable them to move forward. So when you call the lines, you'll hear about what's available and how the face-to-face visits are going to be happening at various sites and for various teams. But that's the update. And so I don't know if you have anything to add about that, Beth, or any of the panelists want to add to that.
No, I think you did a great job letting everyone know that all of our services are kind of continuing as much to normal as we can, with some slight things that we have to switch around. But we also have, we just like to highlight that our behavioral health clinicians that we have on today, and then 2 others that couldn't join us, are always happy to help as well.
Thank you, Beth. That's great. All right, so the first question for the panel is about the general question of how, what do you advise primary care providers in regard to your recommendations for families to stay safe at home? And so whoever wants to take that should step up to the plate.
Yeah, hi there. So thanks for this opportunity to do this. So when I think about that question, there are 2 components. Clearly, we want to think about safety in terms of the precautions that the pediatricians and the medical field are advising us to do in terms of the social distancing and staying at home, and doing all the washing, of course, that we're required to do to keep hygiene and safe in that way. The question really what we were thinking about is the routines. So just in having done a lot of research and looking at YouTube videos and things that have been forwarded and things that we do find online, there's this common theme of the structure piece in trying to keep routine as predictable as we possibly can. And clearly we're not teachers, some of us, and we're not home tutors and things like that. So a lot of this has to do with some of the looking at a visual routine and how can you get suggestions around, a 9 to 5 or 9 to 3 and keeping it as predictable as possible. The common theme has been stick to a routine, go outside when you can, get creative with activities. So you have there the daily schedule, for instance. And I think this was actually forwarded around by some of our pediatricians who found this, and also I got it from Dr. DeVere, our child psychiatrist at MCPAP, and they sent it to me, thinking it might be something great to share as well. So just in terms of, you know, wanting to set limits, I think one of the biggest things right now for kids is wanting to spend some time on the iPads and all the electronic stuff, which on one hand is great for FaceTiming and keeping kids engaged also with their academics. That has been something that, you know, that I'm hearing a lot of, is that schools are finding ways to really keep kids engaged in these ways. But we want to limit some time and perhaps make it an incentive that once they get how many hours you might think might be helpful in their academic time to complete, then they can get 10, 15 minutes, half hour, an hour, and work up to that. I think that's been really helpful personally for me with my 9-year-old, in keeping some type of structure. You know, we always try to maintain wake up time, the morning time, lunch time, meal times, and downtime, actually very consistent. And in between, having some level of structure that you can strategize. This daily schedule is a template. There are a lot of different templates out there, and we want to remember to stay as age appropriate as we can with some of this. Clearly, it is a challenge if you're working from home and you're trying to engage with your little ones, and at the same time you're trying to navigate how are you going to be available for the phone schedule or a phone conference. So just trying to be strategic around some of this. So yeah, sticking to routine as best as you can, picking and choosing your battles, as a lot of kids might see this as a vacation, or for those kids who have become a bit more anxious, I have been getting a few calls around that, and we want to be, you know, taking care of ourselves too, and how we're responding. Clearly, this is a unique situation, and they're going to need attention and support and reassurance. You know, leaning on each other. There's this phase of coming to this acceptance of where we're at right now and keeping a sense of perspective. But we're here. This is the other thing in terms of what MCPAP is available for too, is that if you find yourself addressing or responding to calls where parents are really struggling, we are here. You can call our program, you can call our program coordinators. They'll take the referral, and we can respond to pretty soon as to, you know, some of those concerns you might have. So the other thing is, you know, this is a time also when you have this daily schedule for older kids who are on their way to school, for instance, or they're home, you know, can this be a time for teaching life skills? For the younger kids, clearly board games and writing letters to loved ones and finding all sorts of creative ways and keeping them engaged, but also with the older ones, how do you keep them engaged and off the iPads, and being able to think about ways in which to engage where they're, you know, they're finding some meaning in this as well. So, you know, plenty of kids need to learn how to do their laundry for college or other chores and tasks. So one of my colleagues actually just told me about the structure and routine that one of her neighbors has successfully engaged in. And Martine, maybe you want to speak to that a little later, but it sounded like there was some, you know, some success in how she was planning her day and working at the same time. So if anyone has any questions around that, please feel free to chime in.
Thank you very much, Danette. And I think we may get back to this for more discussion about, because it's a really big challenge. One of the things that that's really challenging, especially for younger kids, is just this whole issue of social distancing and how that, you know what to do about trying to implement social distancing, especially with young kids. And I don't know if you have any thoughts about that, or if we want to, you know, the issue of play dates. I mean, I think that people are not, yet sort of wrapping their heads around this fully, but you know, and there's differences of opinion about that in the community. But as far as I understand, play dates really need to be, you know, suspended.
Yes, yeah.
And but within homes, you know, I think it's really difficult to do social isolation even without play dates, you know, for younger kids. So I don't know if you have anything to add about that.
I mean, some of the ways in which I've heard people are doing is the online video chats, the FaceTime with their friends, writing letters. So again, trying your hardest to do the creative ways in keeping kids engaged with their friends. But yeah, that's a big challenge right now. So.
Okay, so another question that I have is really around how to talk to kids about, you know, COVID-19 particularly. And so I think one of you is planning to tell us about that.
Yes, thank you very much. So we want to encourage parents to obviously talk to their children about COVID-19. And parents should try to provide a calm, accurate, reassuring language for their children. Obviously, the age of the child will influence the way we talk to our children, but parents should really encourage the child to share their understanding of COVID-19. And when they share their understanding, that gives parents the opportunity to then correct any inaccuracies or misinformation that the children might have in their head, and that might help reassure the child. Also, we want parents to make certain that they validate and listen to the child's anxiety, fears, and sense of loss. As we know, losing your school program and the social connections with your friends for a significant period of time, it's a real loss, and the parents should really make certain that the child is heard and his or her feelings are validated in that respect. Also, we want parents to limit the access that children have to media and news reports on COVID-19. You know, based on the age, it might be appropriate for, you know, 1 to 2 times a day for a 5-minute period to listen to reports or watch news updates on COVID-19. But obviously, we don't want to have the child spend the entire day perseverating about the latest change and the latest global impact. Additionally, after the first main discussion that a parent would have with their child, we want to try to minimize the amount of discussion about COVID-19. As Danette said, we want to try to normalize family life as much as possible. And, you know, obviously it's going to be an aspect of it, but we do want to keep the routine going as much as possible. Additionally, parents would have to appreciate that, especially with preteens and teens, that because they've lost their social contact from school and they're not really exposed to their friends as much, within reason, it's understandable that the children are going to be on social media perhaps a little bit more, trying to make that contact with their friends. So anticipate that they're going to crave that probably a little bit more. And within reason, again, it's totally normal, especially for certain populations, to be on social media more than they usually would be. And parents need to convey to children that we should focus on the things that we can maintain control with. Or we're going to focus on the things that we have control in life and not worry about the things that we don't really have much control over. And parents should, of course, reassure their children that they're doing the best they can to protect them, keep them safe. And then finally, parents should instill a hopeful outlook for the future, in that if a family member or child happens to contract the COVID-19, we must remind the children that it's highly likely that that person's going to survive, and eventually this COVID-19 will be behind us all. It will be in the rearview mirror, and eventually the child will return to school, and life as normal as we recall will eventually return to all of us. Thank you.
Thanks, Mark. I think that the point that you made really underscores the issue about the need for parents to have help, themselves as well, whether it's self-care or whether they need, their own help to manage the anxiety that they feel about this because of the fact that kids, I think you implied this, but a lot of anxiety, in children is generated because of cues, that they receive from people around them. So children, they don't always know what to be afraid of, and so they follow the cue of their parent in terms of whether or not to be afraid of something and how afraid that they should be. And so if parents are overwhelmed with dread and anxiety and having difficulty managing that, then that's going to have a very strong influence on the kids. And so I think that that's another piece is for primary care providers to talk with parents about self-care, for themselves, and also to try to get resources for parents if they're really overwhelmed and they're not able to manage, the anxiety that they feel, because it's going to, yeah. So thank you so much. So the next question is about the challenge of how to distinguish, sort of the physical isolation, that is recommended, as part of social distancing, from what would be a concern about more unhealthy emotional isolation and sort of internal preoccupation and just sort of kids becoming withdrawn from relationships and people around them, which would be a sign of depression or of some kind of mental health issue that needs to be addressed. And so I think one of you was going to speak to that.
Yes, yeah, obviously preventative physical isolation is a necessary approach, but we want to avoid children feeling emotionally isolated as well. Emotional isolation is not a good thing, of course. And, in a plausible scenario where a child is being quarantined, parents have to be reminded that that child is going to be emotionally fragile, more so than the average person. And the parents really need to be extra attentive to that child in their emotional support. And, they have to be cautious that the child doesn't feel like a pariah in their old house just because they're being quarantined at home. So we encourage parents to be reminded that they've got to try to keep that quarantined child a part of the family activities as much as possible while they're quarantined in the home. And also, however, if someone's physically healthy regardless, some children, as you said, Barry, are not going to handle this situation very well. And their feelings of loss with the school closing, with being disconnected from their friends, is going to really negatively impact them. So if the parents see that their child has regressed in terms of their communication level, isolating in their room, not sleeping, etc., for like 2 days or more period of time, then the parents should be really encouraged to contact the pediatrician office, and the pediatricians can then call us and can be offered referrals or perhaps a face-to-face, or in the worst case scenario, the parents should be recommended, they should be encouraged to contact a local crisis team. Thank you.
Thank you, Mark. That's great. So there's another question about just the lack of structure and how to keep kids from sitting around worrying and obsessing and things like that. I'm not sure. I know that Danette covered a lot of material about this in the first question, but was there more that we wanted to say about that? I didn't know if Martine had prepared something.
I think Danette was going to add to this.
Oh, okay.
I think I sort of made it concise and put it all together, but I think if the pediatricians had more questions later about it, I could chime off that.
Thank you, Danette. Yeah, I think the sample schedule is very helpful, and I hope people consider copying that out and using that as a handout for parents. So the next question is about just how to talk about people who test positive. And so families have extended family members or family friends or people within the family who have tested positive and who may be sick. And what are some recommendations for how to talk about that inside within the family?
So I'm going to address that. I think the most important thing is to give support to the parents through this, and help the children understand that it's an illness and their bodies have to heal, and everyone's going to work at helping them get better. And with it, there are things they're going to need to do to help other people not get sick if possible, but it's not their fault if other people do get sick. In talking to other parents from the pediatricians, what would be very helpful is very concrete things about what they can do at home, and how to monitor, how to care for their child while they're at home, and clear instructions on how to help their child be more comfortable, whatever the treatments are, and contact with the practice so that they're not alone in caring for their child. I don't know if this is possible, but another parent told me that her children love their pediatrician. They look forward they love being sick because they get to see their pediatrician. So I don't know if there's a way for the pediatrician to speak directly with the child. And I would look at it as it's like when you get home, when you're homesick with a bug or something, and you'll get better, and your family's here to make it all work out. And when my neighbor who's doing the schedule piece, very similar to the one that's up here, and tried to talk with her kids about, are you worried, or gave them some time to share what's going on. And they said, no, we feel fine because you're here, you're taking care of it. So I do think if kids know that their parents and the adults are addressing the big questions, and they just need to continue being kids within the context of this situation, they feel they'll be okay. The other thing is if they have things they can do in the same way that if parents can have things that they're doing to help their children if they're ill, if kids have things they can do, like having one of the chores be wiping down all the doorknobs every day and the banister in areas, or different ways they can participate in the project that we're all working on, which is surviving health, getting through. So while people do get sick and get better, we're just trying to help it so that it's not so all at once.
Thank you, Martine. That's great. So I do have a question from an audience member, and it has to do with misinformation, which is spreading rampantly. In some cases, is being disseminated by people who are leaders in our government. And so what thoughts do you guys have on the panel about how we clarify information that might sort of come up, in front of kids that is really clearly not accurate? And how do we support kids and their families in getting correct information and remaining safe? That's a great question. I'm not sure who asked that, but it came through from an audience member.
Well, I can try to just address that we can obviously just do the best we can in just saying that, some things you're going to hear is not necessarily reality-based, and then based on the facts that we as parents have, will then just correct or alter some of the misinformation. But just remind the child that, you know, occasionally you're going to hear things that may or may not be true. And if you're uncertain about it, you know, check in with your parent, and we'll try to get you the most accurate information possible.
Yeah. So parents are the most important leader that kids look to for information about what to be afraid of and what not to be afraid of, as we were talking about before. And so I think parents can really help, you know, prevent kids from being vulnerable to misinformation. And so that's, I think, really good advice from Mark about really trying to clarify as best you can. And as has been said, you know, already from the panel, to really encourage, you know, kids to ask questions, so that because kids might hear things and not even sort of ask about it, you know, because they're just exposed to so much information these days through social media. So there's a question about elderly people. So many children, maybe not most, but a large, you know, number of children in the community have people in their lives, you know, who either have risk factors or are elderly, you know, whether they're grandparents, older parents, you know, whatever. And so what do we want to tell kids about how to think about that? Because I think that could be a source of pretty intense worry for kids, and also just around how to keep in touch with people who have much higher levels of isolation because of their risk factors or their age.
Yeah, I'll answer that. I think, you know, we also have to continue to repeat ourselves around the social distancing and how, you know, this population has to really take care of themselves, maybe a little bit more so as well because of the risk factor, but that they're following, you know, the instruction of experts who have encouraged this. And in terms of the isolation, I myself have 77-year-old mom who's in a facility, and my 9-year-old was asking about her and seeming to feel a little worried, and I just reassured him in that way. And also we're using a lot of FaceTime and being able to communicate with her. And my next intervention will be trying to write a letter as well, but keeping in touch in those ways. And I think certain agencies vary in terms of, a lot of them aren't accepting visitors at this point, but I see some things where the people are on, you know, in the vicinity, looking in their windows because the agency has allowed that, or performing outside the window if they're allowed to, you know, see that. So I mean, these are, I think it varies throughout agencies, but for the most part right now, there are no visitors, it seems like, going unless they're at a later stage of, you know, of hospice, for instance. So, you know, providing support and reassurance, and like Mark said, asking them questions, because sometimes what we think they're fearful of isn't always what they're asking about. So.
Barry?
Yes, sir. Dr. Strauss.
How are you doing? Just a thought about that issue. As a grandparent with the 7 grandkids, we learned the other day that I always thought Zoom was a sort of a business application, but it actually has a personal application, and I think it's $15. You get a Zoom account, you just go on Zoom, you get a Zoom account, and we were able to bring all our grandkids onto a Zoom call because we obviously can't see them as being grandparent age. And it was a lot of fun they interacted with each other, and we had a great call. So I really urge people to think about getting your own personal Zoom account, because you can, rather than just do FaceTime, which is basically just two-way, you can get the whole family or your whole social group or your play group or whatever onto your Zoom call.
That's great. Thanks a lot, John. That's a really good point. I think that this MCPAP work that we do is focused on children, but we also have to talk about, and we need to talk about the mental health needs of parents who are so important in the lives of children. But at the same time, I think that there's this convergence of value that can occur when we encourage children to reach out to their grandparents or other relatives who are isolated. So unlike John, there are a lot of people who need to be at a higher level of isolation and who don't have a lot of networks of friends and family to talk to, and so there could be some nice volunteer opportunities, I think, for kids, potentially for older kids, to do volunteer work not only for their own families but through religious organizations to find opportunities for kids to have outreach calls to isolated elderly people in the community. And so there could be sort of creative opportunities potentially for kids to be involved in supporting other members of the community who are really at risk because they have to be isolated for a prolonged period of time.
Yeah, and I'll add to that. This is Beth. But even just going for a walk and leaving a note in an elderly or someone that in your neighborhood that might be more isolated, having, like, my nieces have been putting notes in people's mailboxes so that way they feel like they're connected. And then those residents have actually come back and left a little something in their mailbox, which is really nice.
That's a really nice idea, Beth. Yeah, so this not only helps the people in the community, but it gives kids kind of a feeling of purpose and makes them feel and can be very, very helpful in terms of giving them something to do, but also giving them a sense of having some control and ability to help in this collective crisis that we're all going through.
In the Globe the other day, there was a story of a family of kids who started making masks.
Masks?
And, trying to be part of some of the community groups who are doing things like that, or really turns things around so it's a more positive. You're spending your time more positive than just mulling over how bad things may be.
And I just want to add, I think that's such an important thing for kids too, just that sense of what you're saying, Barry, that self-control, self-efficacy during this time of, during times of fear and uncertainty, that kids feel like they do have that control and playing an active role in helping themselves and family and getting involved in community. So there seems to be a lot of that going on.
So we have a question from Eric Ruby. Dr. Ruby, I wonder if he might like to ask it live. And so I wonder if we could just unmute Dr. Ruby's line. If that doesn't work, I can just read it. Is that possible?
I think we're working on it, but if you could read the question in the meantime, and then maybe
Okay.
he could jump on.
Yeah, I'll go ahead. I'm not sure I can do it justice, but apparently he heard on the radio this morning that there's a resource that's organized from the Child Mind organization in New York City. I think it's connected to NYU, the Child Study Center at NYU. And it sounds like an interesting resource. He suggested that we might want to be involved in that just from the MCPAP side, that there's some kind of radio show or a call-in show with a discussion on this topic. And so, so I don't have more information about that, but if Eric is able to speak, then he might be able to tell us more.
Can you hear me now?
Yes.
Yes, you can hear me. Very nice.
Thank you so much.
I think it's
Well-
in one of our resources as well. We'll have it at the end. The Child Mind Institute is one of the resources we have at the end of our slides. They've been doing a daily tips for parents.
Well,
Okay.
I accessed it this morning right before I left for the office, and it seemed quite legitimate, and there were a lot of references, and they had a lot of information.
Yeah,
the
they're
reason
very
I-
good.
Yeah, the reason I say this is that MCPAP is always in the back of my mind, but it really needs to be in the front of my mind, because so many kids really need help, and so many parents really don't know where to turn. And here in Taunton, this CCBC just does not seem to answer the need, or at least the parent, when they come back to see me for whatever that problem was. I say, how are you doing with counseling? And they say, oh, it hasn't started yet. I have found that MCPAP is very responsive to me, but again, there are wait times. Also, some of the people in Taunton can't get to MCPAP for a visit. But I do feel that not only the pediatricians need to be reminded that you're out there, but parents need to be reminded that you're out there. Again, you may get bombarded if the parents know about you. So there is a double-edged sword there. But going on the talk shows, I think at this point in time, particularly after the kids go to sleep, would be a good thing to do. And it will certainly increase your exposure, give more validity to the psychiatric community and also to the pediatric community. So that would be my thought there. And now WBZ is what I listen to, and I do feel their news is credible. So that's one thing, and I do want you to address that. But on the plan and the suggestions for the routine schedule, my feeling is, because I have 3 grandchildren who are cooped up and another 2 that are also cooped up, Colorado and Connecticut. The question is, what would you like to do today? And what do you need to do today? And then organize it. And even last week, I was telling people, have a plan, have a schedule, because if you don't, it'll be the end of the day and nothing will have been accomplished. So I think it is very important to create a structure, because children do not. And I thank you for the suggestion about the play dates and the video chats and being creative, because the statement was, again, on BZ this morning, and the liquor stores were open, and there was a lady who was going in and buying a lot of liquor, and they said to her, why are you doing this? And she says, I have 4 children at home. So I think there are some other parts of this that need to be addressed as to how the parents can stay sane with all of their children at home.
Thank you very much. Those are great points, Dr. Ruby. And on the issue about MCPAP, getting out, sort of into the public discussion and to be a resource for community and, public education, I think that's a really great point. I think the risk is more that when we talk about MCPAP to the public, it could result in more families really approaching their pediatrician for advice that would call for us being involved, call for the pediatrician to ask us for help. But I don't think that we should worry about that right now. I think that we want to provide as much help as we can. And so I think it's a good idea. One thing to remind you about is just that MCPAP is, it's really made up of people who work at a variety of healthcare institutions all across the state. And so, we do have our central administration, but, we have, these large and influential healthcare institutions that we all work for. Like I work for Bay State, and people work for Partners and Children's and UMass and Tufts. And so most of us are involved in speaking on the news. Like I think I've done about 5 interviews over the last couple of days, but they're not on behalf of MCPAP. They're really on behalf of Bay State. And I think it would be really nice for MCPAP to offer to do this under the auspices of MCPAP to try to increase the visibility of the program. And so I think the way to do that would be for us to develop a press release that might summarize some of the points that we've kind of talked about in this particular call. And then we'll be invited to speak to those points in the press release, because it is of interest in the community. And so I think that's a great idea, and I think we'll talk about it more kind of internally before we proceed, but I think it's a great point. So we have another question from one of the audience members. I think we've addressed some of this already, but I think that maybe that we could talk a little bit more in more detail about it. So the question is that some of our kids are being taken out of their daily routine, with parents not really sure when they're going back to school, and that what can we tell our kids who don't understand why they're being taken out of their routine? And so I would ask if any of the panelists want to add to what they've said before about this.
Yeah, I'll respond to that. It's basically that the decision was made to, we would tell kids that the decision was made to keep them safe, and that eventually, once things are safe, they'll be returning to school. So you're gonna have to, depending on the age, just remind children that it's all about their safety first, and that there is hope that in the future, obviously, that eventually they will return to their school. And, also remind children that, they're really not missing out on anything in terms of their other friends aren't going to school. Their other friends are in the same situation, that they too are stuck at home. And just one other thing about structure, just to add, I think it's important that every child get outside at least a few minutes a day, like riding bikes or going for a walk. I think that's a really healthy thing that could be incorporated in a structure that makes sense.
Great point, Mark. Thank you. So I don't have any other questions from audience members at the moment. So if you've been sort of sitting on any questions, now's the time. We still have a little bit more time left in our program. I guess I would just sort of ask our panelists if there are any other points they want to make in the meantime, before we get more questions or end up ending the discussion for today.
Barry?
Yes.
I wonder if we should just go through the slides, because I think so, which will be posted on the website, so everyone can get a look at them again.
Great. So who wants to speak to the slides? Is one of our panelists for particular ones want to speak to them? So the first slide is about COVID-19 resources. I wonder if one of our panelists wants to speak to that one.
This is Martine. I think I wanted to add to what you were saying before, Barry, in terms of what we might want to say. I think MCPAP behavioral health clinicians are available to help the pediatricians reach out to families, and you're on the front lines in terms of knowing who's having some harder times, and we can be used as a resource to reach out. And then these resources there's a lot out there, and it could be really helpful for us to be able to pinpoint some to certain families, or work through helping regulate the parents first and sorting out what are some of the problems that are going on. So please think of using the behavioral health clinicians as well for when you're concerned about your families and your children.
Thank you, Martine. So does anyone want to speak to this slide about resources? I mean, I think the slides are in a way, you know, meant to be a reference for people, because you can copy them out as handouts and just kind of be able to summarize some of the things that we've talked about already. But I don't know if anybody wants to speak to this particular one. Just to have, of course, you know, was someone about to say something? So the CDC website is it's kind of like the single source of truth about you know, this disease, but apparently they have some recommendations about talking with children about the issue. I have not looked at that particular page myself, but it's certainly worth taking a look at. And then ACAP on that website, ACAP is the American Academy for Child Mental and Psychiatry. They have lots of facts for families. And so they developed a handout as well, summarizing some advice for parents. And so those could be really good handouts for people. I'm not familiar with the childtrends.org organization, but apparently I think that's certainly worth a look as well. Do you want to go to the next slide, Sarah or Beth? Yeah. So it's a cute cartoon that people, again, this is a reference, you know, for people that you know, when you're explaining, you know, to children about the COVID, you know, the nature of it, you know, and what it is. This might be a nice little tool, especially for younger kids. But I'm not sure who the artist who did that, but it looks very, very nice, and it's reassuring, but it's not you know, unrealistic, you know, but it has you know, sort of encouraging words, you know, about it to avoid people being overwhelmed, you know, with fear. And it has recommendations about social distancing too. The next slide. So this just summarizes some of the things we're talking about, maybe going into a little bit more detail about activities during quarantine, you know, with ideas, and this came from UMass. I don't know, Danette, if you wanted to speak to that at all. It's certainly something that you talked about in your remarks about this topic.
Yeah, I mean, I think staying creative is the key here, and clearly some of our activities are all based on age and age-appropriate kinds of things. But staying involved with the kids and making some time to be able to be part of what they're enjoying as well. So.
Great. Thank you, Danette.
Yeah, and I think it's true with all of our, whether it's like resources. This is where MCPAP can also be helpful, like by calling us. Our behavioral health clinicians, I'm sure, have even more than we do slides with information or ways to help problem solve or help inspire new ideas for that creativity. Because I know sometimes when you're stressed,
yes,
it's difficult to come up and be creative. But this is kind of one of the things that of the many things that we at MCPAP can help with.
Yeah, and there's a lot of resources going on out there right now. I think someone, Dr. Ruby said it earlier too, the Childmind Institute has been creating a lot of different things as well and being available. Probably, you know, every day they have parenting tips, and there are other clinicians out there doing the same thing with some great ideas.
Thank you. So we do have another question that came up. I'm not sure that that we necessarily are the source of advice about this, but we certainly could talk about it. Could you give any suggestions for professionals such as social workers, psychologists, et cetera, who are working in the field of child protection, or just in general, any tips for interventions for professionals in that field? And this is from Zlatina Kostova. who's a psychologist from UMass. So I guess I would say I don't have anything specific about that, but there's a lot of work that is being done and needs to be done to address the psychological needs of some of the frontline sort of healthcare workers who are basically, you know, in the trenches and putting themselves at substantial risk, you know, to take care of sick patients in the hospital and in the community. And so at Bay State, for example, we're trying to organize some clinical models of providing sort of psychological first aid, as well as resiliency kind of psychoeducation to teams and individuals to try to support them in the hospital. I guess that's different from the whole issue about people who are in the child protective services field, who are have a whole set of risks, you know, when they're working in the community with children, and sometimes are in loco parentis and really kind of need the same advice that we're giving parents, you know, about how to take care of children. But I wonder if any of our panelists have anything to add to that or to say.
So I would be curious about the question itself in terms of child protection. Are they talking about kids in foster care or going out to the homes or things like that? I mean, in cases like this, you know, there are different things that are coming up for kids who might be in foster care in terms of are they relating this to something previously that's happened that can be concerning or fearful to them?
Yeah.
And are they, you know, what are the behaviors in that sense? We want to make sure that kids are, you know, having some success with sleep, for instance, because that can make things a little more dysregulated as well. And you know, we need to figure out ways in terms of how to be reassuring to them in these times, because there are a lot of kids out there under other people's care who might be feeling some more vulnerability.
Yeah.
So, you know, I guess I'd be curious about the question more specifically around what they're asking.
Yeah. So I think the question, we could always unmute. I think we're running out of time, so I hesitate to do that. But at this point, I think the question was focused more on the professionals and how the professionals who are doing this work in the community, how to support them and what their needs are. So I think it's more for the workforce.
Okay. Yeah.
But in any case,
obviously the staff people need to be, their feelings and fears and anxiety have to be validated either through supervision or their, you know, family members. But as true with children, all of us want to be understood and all of us want our feelings validated. But I would also try to suggest that those people, the first responders that do have to work, and maybe they're going to need like a virtual support group among fellow employees who are experiencing the same type of anxiety and who might not feel the validation or the support that they need, even though they're mandated to continue to work.
Yeah. So I think that those people who are going out in the community and going to people's homes, that they're definitely putting themselves, you know, in harm's way to help children, and they deserve our support and respect, and so that they have a set of needs that are pretty compelling. But it's unfortunate we don't have time to go, you know, that far beyond the scope of this particular topic today. But it's certainly an important issue. I guess there is a comment on the question and answer kind of function from Kendra Frederick, who was asking to pass along that the Child Life Department at UMass has some additional resources on their Facebook page. I guess you can search Facebook for Child Life at UMass. That's relevant to this topic and could be an additional resource for people. So I think that, people can get the copies of the slides. The last slide that's displayed right now is just a reminder about our MCPAP hotlines and the numbers, and just a reminder that you should certainly feel free to utilize MCPAP as usual, and that that we're prepared and eager to help in any way that we can with issues regarding the mental health of any child or adolescent or transitional age youth who's in the care of a pediatric primary care provider. But I think we're going to have to end. Thank you so much for all of the panelists' insights, really excellent recommendations and excellent presentations. And thank you all.
Thank you.
Thank you.
My pleasure.
We'll